Hello everyone, my name is Denise Molina Capers and I am the Director of the Racial and Social Justice Department. Welcome to the RSJ Forum. Today we will be talking about the Public Safety for All initiative, which is a community-driven initiative to create and shape public policies for the safety of our constituents of Somerville. I am very honored to welcome today some of the leadership of the City of Somerville that helps to execute safety within the city for our Somerville constituents today. Our Chief of the Somerville Police Department, Charles Femino. We have the Director of Health and Human Services, Karen Carroll. We have our Chief of the Somerville Fire Department, Charles Breen. And we have Steve Craig, our Director of 311 and Constituent Services. Our panelists are convened here today because they lead the efforts to keep our constituents safe in the city of Somerville. And so today, we want to know first and foremost, what is your vision of public safety for the city of Somerville?
Well, from my perspective, I envision a community-driven, shaped police department, which means the city officials, the police department, and the community itself have input and meets at some happy medium so that the public policies that are shaped will have impact for all of the community at large.
Thank you, Chief.
I think from the public health point of view, I see it as the community as an open space with a river running through it. And we work along the side of the river to prevent people from falling into the river or getting in trouble in the river. And if I'm doing my job well at the prevention end, we're making sure people don't get in that river in the first place. And we're doing that with a number of different prevention programs, from disease prevention to harm reduction, opiate use, substance use, mental health, all of the ways in which people can falter and find themselves in trouble or in an unhealthy place they don't want to be in. So for me, I try to look at it that way, and I try to always be thinking upstream, that if we're doing our job in public health and prevention, you guys will have an easier time at your end fishing people out of the river who might be in trouble. So, and always with a focus on the most vulnerable. I think that's part of our role, is to hone in on the most vulnerable in our community who might need the most support from us. So.
And the voices that we should be listening to.
Exactly, exactly.
And I think you make a good point, Karen, in stating that the public health portion of public safety, right? Because the reason why you're all here as leaders of public safety in the city is because public safety has to do with so many different areas within the city. It has to do with health, it has to do with law enforcement, it has to do with fire prevention. And so, Chief, what is your vision for public safety in the city?
My vision, it goes beyond just fires. It encompasses a lot of other things. For instance, this winter, we were tasked with opening up a warming shelter for our unhoused population. That involved the fire department. We had to inspect the proposed shelter areas, and we worked with Health and Human Services, the police department, ISD, to get that shelter up and running. So it involves, we also, we had cold weather that we handed out. The fire department and the police department were given backpacks by Health and Human Services to any homeless people that we came across. We were able to hand them out backpacks which contained blankets, hats, gloves, and whatnot. We also work with the fire department, works with elderly services. We do safety checks in our elder residents' homes. Not only do we install smoke and CO detectors, we check for trip hazards. We distribute night lights. We distribute non-slip socks. Now we just started issuing lock boxes for elders that live alone in case they fall. If they activate their lifeline alarm, we don't have to force entry into the house. We'll have a key with a code, and we install it, and then we can let ourselves in. And that makes the elderly people feel safer, and they know we're not going to have to damage their property. Vision Zero is another thing that I, as the fire chief, work with, mobility, because we want our pedestrians, we want our bicyclists, and we want our motorists to be safe in the city. And I work, with mobility on the speed bumps and traffic calming measures to make sure that it works for everybody. So that's how I look at things.
And I think it's important to notice, Chief Green points out the importance of how all of our different departments intertwine.
Exactly.
Yes.
And rely on each other, because there may be an issue in any one of the concepts that Chief Green just brought out, or in your department with working with the homeless, working with the citizens. Regardless of what we're doing in the city, we're constantly in touch with each other, communicating with each other, because a lot of these issues are intertwined.
There's a high level of collaboration
Exactly.
and intention,
Yes.
is what I'm hearing.
Yeah.
And I know that you, Director Craig, you have a lot of communication with our constituents. So what is your public safety vision for the city?
Well, as you pointed out, we deal with a large number of services and issues for the community. While we do refer a lot of things to police, to HHS, to fire, there are a lot of non-emergency issues that we're handling, such as road conditions, road defects, sidewalks, even rodent control. So for me, the vision is having that effective communication not only with the other departments, but with the constituents, because we want people to feel comfortable being able to reach out to the city and having the trust and the confidence that something's actually going to be done when they reach out to us to report an issue.
Absolutely. So you mentioned the word issue, and I want to really talk about the complexities of public safety, and especially being in leadership roles, you know very much the emergencies that may come up and the complexities and the challenges of doing this work. So can you talk to us a little bit about what are some of the challenges that you face within your departments, within your leadership roles around public safety, and really trying to affect changes and keeping our constituents safe?
I'll jump in here.
Yeah, whoever wants to jump in.
We learned so much during COVID about our most vulnerable residents. We saw the inequities about who was affected worse by this disease. And again, it's so many of the social inequities that we already knew and saw. It's around housing, it's around job security, livable wage, having access to the internet, things we might take for granted. But I think, the challenge for us is to continue to focus on how do we build stronger, more resilient, equitable communities that can withstand all of the challenges that come at us. And if we don't start from a basic place of safety and a home and food and things, sick time, those kinds of things, we're kind of getting off on the wrong foot. We're behind before we start. So
absolutely,
that's a challenge for us.
Yeah, well, for my department, not to echo what you were saying, because that's part of our challenges also, but as in many other communities, law enforcement are facing similar challenges with recruitment, retention of officers, keeping high morale for officers. But one of the bigger challenges for us, as a department as a whole, is the ability to be able to have enough staffing. Our staffing levels are low, which has caused us as a department to become reactive and only be able to respond for calls for services. And we have very little proactive community policing going on in the city right now. And one of the challenges I have, and I think into the future, is to try to find ways to build that community trust through community policing, community outreach for by the officers moving into the future of policing in Somerville.
Chief, could you tell us a little bit about the importance of being able to address public safety in a proactive way versus a reactive way? Like, what is the difference between proactive policing and reactive policing?
Well, in a simpler stage, proactive policing allows officers to interact and engage in the community in a positive way, so that they build trust and legitimacy within the community with those who they serve. It makes the job a lot easier for officers who have that trust and legitimacy to do their job. But in addition, the information exchange between the citizens and the police is in a positive way. As compared to a reactive department, which right now we have become, it's really responding to calls for service as they come in, spending less time at a particular call trying to resolve the root issue of what's going on. It's basically going to a call, handling the call in the short term, and leaving. And there's no positive interaction or future building of legitimacy for the police department.
Thank you. Chief Breen, what are some of the challenges that your department faces in addressing public safety?
One of the biggest challenges is just the explosive growth that's going on in the city right now, and that results in a continuing rise for calls for service for the fire department, and that can lead to also longer response times. And the great thing is that we have a new fire station under construction at Assembly Square, and then once that fire station opens, we'll be adding another engine company down at Assembly. And hiring more firefighters to staff that. So that's going to be a huge improvement for us. It's going to cut down on response times, and it's going to help us serve what's basically become a new neighborhood that we've added to the city. So that's one of the biggest challenges, and it is being addressed.
And I would echo the same type of a challenge with the police department. I mean, we have a city which is growing by the day. Calls for services is going to increase, but the expectations for service by the police department, as well as the fire department, it continues to grow. So I think staffing, for me, is an important issue because we're understaffed at this point, and at least in the immediate future, we don't foresee the additional staffing coming into play.
And calls for service also come in through 311. So what are some of the public safety challenges that 311 faces and Constituent Services faces in addressing public safety?
I would say our challenges are somewhat similar to what we just discussed. As the city grows, we can see up to 10,000 or so calls for service in a given month, and we have a wide range of services that we support across the city, and every one of them is important to the person who makes the report. But in terms of how we organize and respond to things, sometimes we have to prioritize items based on resources, or we don't have the staffing capacity to get things as fast as we want them to, but we want to make sure that everyone understands that they're important and that we're going to get to them. But I think that the challenge is just effectively getting things done as fast as everybody wants them to versus what we're able to do. And there can be a gap at times, and trying to figure out how to close that gap, I think, is one of the big challenges for us.
One of the themes that's coming across clear to me is the fact that even though one of the challenges the departments may face is staffing, the value in serving our constituents and not just being a presence in the moment, but actually forming trusting relationships with our constituents is very important to each of your departments. Could you tell me a little bit about what are you doing actively now in order to build that trust with our constituents and actively interact with our constituents?
I'll start. I think the fire department has a pretty good trust factor with the community in general, but I would like to see the department more adequately reflect the people that live in the city, and we need to expand our diversity on the fire department. I'm working with you, Denise, and with other city human resources and whatever other city agencies to come up with some plans to try to increase our not only the type of we need more diverse people taking the fire exams and whatnot. We need to get the word out that these exams happen. We need to try to find out the reasons why more diverse people are not taking the exam and address those issues, and then hopefully get the department to more adequately reflect the community that it serves. And I think that will be a great benefit to us because, obviously people are more comfortable dealing with people that are like them.
Definitely, and I know we are working hard to get an assessment of what access and opportunity looks like for our constituents in the city, and so I'm looking forward to continuing that work with you. Director Craig?
So we have a program, it's called the ACE Initiative. And the ACE Initiative is a customer-focused program that its goal is to ensure that every interaction, every request that gets submitted is handled accurately, courteously, and easily. And you know that's the acronym, but the thought behind it, the whole idea behind the initiative is to ensure that from when we're designing programs and policies to how we train staff to how we report out the data, that there is a customer constituent focus in everything that we're doing. So we're not just working to, you know, check a list of boxes internally, but that we're actually meeting the needs of the community as well. So the ACE initiative is really our key driver in customer success.
And how long has that initiative been in place for your department?
Almost 15 years now.
That's awesome. That's really great.
Great. In public health, I think we have to try lots of different approaches to figure out how people can hear our message, understand the information that's sometimes complex. And again, we saw that through COVID, who can be trusted messengers, and partnering with those, whether it's a faith-based community or you know, a youth peer leader, something like that. We also have a community health worker grant that we've just taken on. We're really excited. Hope to partner and develop the work of community health workers who are from the community, reflect the community, and then are working out in the community to help reach people and help people understand and answer questions, provide access, those kinds of things. So we keep trying all the different ways. Yeah. Chief?
I think for us, it's somewhat different in the sense that we're dealing with people in the real time, real moment, in the moment of crisis many times. And so I think that one of the things that we need to do, and what we try to do to build legitimacy or trust, is to take a minute and listen. I think one of the important things for an officer to do is to take time to listen to the person that they're interacting with. One of the philosophies that we try to build in Somerville Police Department is the practice of procedural justice, which in essence means, you know, you're using your empathy, you're listening to the person. I like to instill in officers, you know, the person that they're interacting with is just the tip of an iceberg, and beneath that waterline lies a story of that person.
Absolutely.
And to take that story into consideration when using your discretion to make your decisions. And that's with every interaction that an officer is dealing with on a daily basis. And if we can instill that in officers through training, which is a big part of that, you know, we go through crisis intervention training, at least 40 hours. We have about an 86 percentile rate right now. Our goal is to have all officers go through that specialized 40 hours of training for de-escalation. We take procedural justice, anti-bias policing. There are many specialized courses that we train our officers, but the bottom line is that they all lend themselves to procedural justice, the concept of procedural justice, to build trust and legitimacy.
Absolutely. We're about to wrap this up, but I want to give everyone an opportunity to share any final thoughts before we do.
I just think it's important that the public knows how much interdepartment cooperation goes on. It's amazing work, like Karen and the Chief Feminine brought up. So many things, they cross different departments.
They intersect,
and
yes.
they intersect, and it's great working with everyone. Everybody works together to get things done.
And I think to be proactive, like you were talking, to be proactive departments and preventative, we have to do that, and we also rely on each other for data to understand what the big issues are. And you know, 311 is giving us data. We need to understand overdoses or where people are having trouble in heat every year in the city. Like all of these things, we rely on each other for the setting of priorities and to be able to be proactive together.
Absolutely. Well, I want to thank our leadership team for being here, representing their respective departments, and we value and we honor your service, and this will definitely not be the last time that we call you in to help us understand more about the work and the service that you provide for our city. Thank you very much for joining us today.
Thank you.
Thanks for having us.
Thank you.
Yeah.